I'm Kip Clark from Ultimate Advanced Bodywork. I'm a specialist in the treatment of chronic pain and an advanced clinical massage therapist. And today I'm going to talk about exercises which help with lumbar disc irritation, so lower back pain due to disc pain. People with this problem often have very tight glutes and hamstrings. They've often got quite a straight lumbar spine, so they haven't got a natural curve forward, quite straight there. Also, the pelvis might be tilted back. Right. People who should avoid these exercises: people with facet joint irritation in the lumbar spine, people with spondylolisthesis should avoid them, and if you've also got a more recent acute rupture of a disc, then some of the exercises might not be suitable. Check with a physiotherapist. Right. First exercise is just called knee rocking. All we're going to do here is lie on our back, and I'm just going to hold our knees and just going to gently rock them in towards the chest. So I'm not using my body to make the movement, I'm using my arms. I'm trying to relax my arm on the back. And the higher you bring your knees up, the higher into the lumbar spine you get. So with your knees here, you're getting the lower lumbars. Up here, you're getting more of the high lumbars. So you can alter the position to find the stiff bit of the spine, if you like. Okay, the next exercise is an exercise to strengthen your core stabilisers, but at the same time we're actually going to stretch the gluteus maximus, which is often tight, putting on the back of the pelvis, straightening the lumbar spine, compressing the discs at the front. So with this, what we're going to do is we're going to lie on our back, and we're going to, basically while we're doing the exercise, we need to pull our core in, pull our belly button back to our spine, to try and hold the lumbar spine still and supported, and we're going to, at the same time, we're going to move the legs, but we're trying to really tense the abdomen to hold everything steady while we're moving the legs. And what we're going to do is every time we bring one knee up to the stomach, we're going to do a 2-second stretch. So you just relax, pull it in for 2 seconds, and then come off, and then bring the other one up in 2 seconds. But remember, when the legs are moving, we're trying to really use that core to hold the pelvis and the lumbar spine steady. So we'll do 2 sets of this. Okay. So, have a natural curve in your lower back. You don't want it to be too straight or too bent forward. Try to make sure it doesn't bend forward while you're moving the legs. So 1, 2. 1, 2. 1, 2. Really using that core to stabilise the spine as the legs move. a slight gap under the spine between the floor and the lumbar spine. Okay, I did 15 there. You might want to start doing about 10 and build up to doing about 20. We'll have a brief rest and then we'll do another set. Remember, 2 second stretch, not just 1, 2, it's 2 seconds, so it's 1, 2. 1, 2. 1, 2. I'm breathing out as I do the stretch as well. You can breathe in as you're moving your legs, and then breathe out. Using that core. Okay, the next exercise we're going to do is called a prone leg lift. So we're going to be lying on our front, again engaging our core before we lift the leg, and we're just lifting one leg at a time, just off the floor, just a few centimetres, maybe 10 centimetres up. Okay. Right. So get yourself comfortable. Okay, and another thing, you want to try and keep the pelvis on the floor. Try not to twist the body around to lift the pelvis up. You're just lifting the leg, using the lumbar back muscles and the glutes. Okay, so I did 15. We're going to do 2 sets on each leg, so I'll do 2 sets of 15 on the right leg and 2 sets of 15 on the left leg. Feeling those glutes and those lower back muscles working, and keep the pelvis on the ground, don't twist into it. so we go back to the first leg again now. Okay, so I'm doing 15, but you want to start doing 10 and try and build up to about 20. To the left leg again. Again, I'm holding the leg up for a second or two. When I get to the top, don't just raise and drop it straight away. Hold it a second just to use those muscles. Okay, we're going to do another exercise now to strengthen the quads a bit, help pull the pelvis forward and rebalance the spine and pelvis a little bit. Also strengthens the glutes a bit. Okay, so with this one, what we're doing is putting our feet a bit wider than shoulder width apart, feet forward, and we're going to squat down to use our quads to come back up again. I'm going to bring my arms forward just to balance myself, but you're trying to keep your weight back, so don't put all your weight forward over your knees. You're trying to keep it back as far as possible without obviously falling backwards. You can do it against a wall. If you're worried you might fall backwards, just for stability. So. Okay, making sure the knees don't buckle in or out, just keeping them forward. Making sure you come down to almost 90 degrees. Don't just come down to here, you're coming quite low. Keeping the weight back on the heels. Okay, so going to do 2 sets of 15. Again, start from 10 and build to 20 as you get stronger. So a bit wider than your shoulders. Nice and slow and controlled. quads here. Okay. So now we're going to do some stretching just to try and release some of the muscles that are tight, compressing up that lumbar spine. Also to help correct the muscle imbalance, when your lumbar spine is too straight, it compresses the discs at the front of the spine. So some of these stretches will help to release those tight areas, to take the pressure off the discs and hopefully allow you slightly more natural lumbar curve. So first we're going to do the hamstrings. So again, have your feet a bit wider than shoulder width apart, toes facing forwards, and what we're going to try and do is take a chest down to the ground. What a lot of people do wrong in this one is they'll kind of bend forward like this, have the curve of the back going forward, and try and get their head down to the ground and taking the stretch into other places. It's best to try and keep the spine straight and bring the chest to the ground, so aiming to take that down to the ground, keeping that straight, as opposed to trying to get your head to the ground and having that bent. Okay, so we'll go straight down. We can go to one leg and then the other leg, coming to the adductors a little bit. Okay. So I'll take a breath in. Breathe out, keeping the legs straight, trying to bring the chest to the ground. And not forcing it, just waiting for the hamstrings and perhaps the glutes to let go a bit. Wait for the hamstrings to actually let go and hold the stretch for 30 or 40 seconds. Now we're going to come over to one foot and then the other. So I'll go back into the stretch, breath in, breathe out. Bring the chest to the ground, making sure the lumbar spine's straight. Okay, now we're going to come over, trying to touch that toe. Making sure the knee doesn't buckle in. Again, holding that stretch for 30 seconds, waiting for the hamstring to release and let you into the stretch. Another breath in. Make sure the knee doesn't come forward. Again, trying to relax. Feel where you're tensing your muscles. Try and let that go. Okay, I'm going to do a yoga stretch now. So with this stretch, what we're going to do, we're going to go into a lunge position, like so, with the heel up at the back, toes facing forwards, keeping the hip forward, and don't let that hip drop back, and keeping the body upright. So, take a breath in, quite a long lunge, both knees bent, and breathe out. You're pushing this hip forwards. Try and sink down into the stretch. 20 or so seconds. Then you're going to raise the arms and try and reach up towards the ceiling, making sure you're not leaning forward. Really trying to touch the ceiling with your fingertips. Okay, so do that on the other side. So keep the hips forwards, heel up, toes forward, breath in, breathe out, pushing that hip forward. Raise the arms, stretch coming up around the sides. Breathe out again and try and reach that ceiling. Okay, we're going to stretch, we did the glute maximus earlier on, we're going to stretch some of the smaller glutes, the glute minimus and medius, which might be tight, and adding to your back pain as well, through trigger points. Okay, so we're going to cross one leg over the other, and we're going to keep the hip down initially. So breath in, breathe out, and bring your knee down to the other side, keeping that hip down to isolate the glute muscles. Feeling the stretch around here. Okay, so again crossing the right knee over the left leg now, keeping that hip down, breath in, and breathe out, and take the knee down to the other side. Okay, now we're going to lie on our back and just let our knees rock from side to side, trying to relax the spine as they go to left and right, and try and relax the spine, let everything go, to allow the knees to drop into the ground. So, breath in, breathe out, arms go to the right, wait for that to relax around here. Breathe in. Back up to the middle. Breathe out the other side. Again, tensing the abdomen as you bring the knees back up, engaging the core. Breathing in and breathing out. so doing about 10 of those. Okay. Now we're going to do a standing stretch, which opens up the front of the spine, giving the disc some space. So we'll put the feet shoulder width apart, facing forward. What we're going to do is put my fists either on my lower back or on my glutes, whichever feels better for me. Then I'm going to take a breath in and breathe out. I'm first going to lean over to the right, easing my lumbar spine forward, opening up the discs. Breath in, breathe over to the other side. Going to wait about 8 seconds for the spine to relax and the discs to open up. In the centre, again leaning over. Try using the fists in the curve of the lower back and on the glutes and on the buttocks as well. See which area opens out the tight bits for you. To keep the body long, but still relaxing the spine, not tensing it. Okay, we're going to do another stretch now where you need a dining chair for this one. Put the side on. And what we're going to do with this, this is a really good stretch for really opening out the spine, lengthening it while stretching the tight lower back muscles and glutes. So, I'm going to sit on the towards the edge of the seat, so a bit of a gap there. Knees are a bit wider than shoulder width apart. Okay, and I'm going to take a breath in. It's really important to really just let everything go and just allow everything to lengthen and relax into the stretch for 30 seconds. Okay, so breath in, cross my arms like this, and then breathe out. And let my body hang down between my legs. Waiting for the stiff bits to give and open out. You can twist from one side to the other slightly to come into different tight areas of the back. So try twisting around to the right or the left, feeling for the tight area. And then when you find a tight area, just wait on that point until it eases. Last exercise, we're going to use a yoga block or a yoga brick. You can use a big thick book as well. The important thing is to have the lumbar spine off the brick or the book in mid-air, and that bit on your sacrum on the big bit of bone at the bottom of your spine here. So you actually got the lumbar spine in mid-air, allowing it to open out and release. So I get that positioned correctly under my sacrum, making sure my lumbar spine's above the block. Legs straight. Take a breath in. I'm just going to pop my hands behind my head. Breath in. Okay, so breath in and breathe out. And then just lie back. Expect a bit of discomfort as the spine relaxes into it and the tense bits start to open. That's okay. Again, try to relax every muscle in the body, especially the lumbar spine. Let the spine drop down towards the ground. All those stiff spinal segments to open out at the back. Okay, so that one you might want to hold for longer than a normal stretch. So normal stretches will be 30 seconds. That you'll be doing for about a minute, longer if you feel that your spine hasn't relaxed into it yet. Right, so they're exercises for stiffness and disc irritation in the lower back. Remember to see a doctor or physiotherapist if you've got any more serious problems, and also often you need advanced clinical massage to treat the trigger points causing a lot of the pain and release some of the tight, shortened muscles like the glutes, hamstrings, loosen up the lower back, and to take the compression off the discs. I think that's it for today. Thank you.